Today's video is going to be a more in-depth discussion about diabetes. I had previously recorded an introduction video with just a broad overview about diabetes and prevention about diabetes. There are many things that can be discussed. I can have an entire lecture series just for diabetes, but there's a few points that I want to get across that are very important both in preventing the disease, treating it, hopefully curing the disease, and controlling the problems that happen as a result of diabetes. I brought up a few medications briefly in the previous video. I also excluded a bunch of medications. There are many older medications for diabetes which are much less frequently used nowadays. A very old drug called metformin is still used very commonly because there's very good data with metformin, but other drugs such as sulfonylureas, for example, aren't used that frequently. Another drug called Actos is still used occasionally, but the use of Actos was limited when Avandia, which was the same class of drugs as Actos, was taken off the market because of data that showed that it was harmful to patients. Actos has very good data that it's helpful both for patients and it's helpful to prevent heart disease. It's very good at improving the good cholesterol, which is the HDL, and lowering triglycerides, which are one of the bad cholesterols, especially in diabetics. So if your physician does choose an older medication, either insurance is dictating what you need to be getting because they won't cover other drugs, or there's a specific reason the physician is choosing that drug. It can never hurt to ask, why are you choosing this drug over some of the other medications? But there's usually reasons why we do use some of those drugs. Another point patients often come to me with is, I don't want to start medicine for diabetes because once I start the drug, I can't stop taking it. And that's not true. If someone has diabetes, or even if they're borderline and a physician recommends starting medications, if you're able to improve your diet and exercise, get your weight down substantially, and your blood sugars improve, as long as your pancreas still has adequate function, you may not need any medications for diabetes. The medications that are started can be stopped, and if you maintain a healthy lifestyle, it's possible you can live the rest of your life without ever resuming medications for diabetes. I briefly touched upon preventing diabetes in the last video, and I discussed that exercise and diet has been shown to be more effective than medications at preventing people from becoming diabetic. Well, why is that? There's several reasons. I brought up an analogy of taking an engine out of a smart car and putting it in an Escalade. That small engine will drive the Escalade, but it's going to burn out much sooner. The problem with diabetes is when patients gain weight, fat cells take insulin out of the bloodstream without glucose. So what happens is, in order to maintain that normal insulin to glucose ratio, the pancreas has to produce more and produce more and produce more. Well, the little smart engine driving the Escalade has to work a lot harder than a much bigger engine in the Escalade, and in turn it's going to burn out much sooner. One of the questions I get asked also is, how come I have diabetes? Does that mean that the other 300-pound people in your waiting room also have diabetes? Going back to the Escalade analogy, if we take 10 smart engines, put it in 10 Escalades, and run them all at the same pace and the same distance, not all 10 engines are going to burn out at the same time. One engine may burn out at 1 year, one engine may burn out at 3 years, and the others may die at some point in the middle. The same thing is true for humans. Not every single patient that has a body mass index of 35 for exactly 10 years is going to be diabetic 8 year, 10 year in one day. There's a variance amongst people just like there's a variance amongst engines. The point, however, though, is once there are too many fat cells in the body and the pancreas has to function on overdrive, it's going to burn out sooner than somebody who doesn't have the excess fat cells in the body. So preventing diabetes is key, as number one, you won't need medications, but number two, the complications of diabetes, which is why me as a cardiologist is talking about this. It's not just the heart that gets affected, it affects the eyes, and is one of the most common causes of blindness. It affects the kidneys, and is one of the most common causes of ending up on dialysis. So preventing people from having the disease in the first place, not treating it with medications and putting a Band-Aid on it, would be much more important than treating it where the cat's already out of the bag and it's hard to get everything better controlled. From a patient standpoint, the prevention and treatment of diabetes is very similar. We encourage patients to increase their exercise. We encourage them to watch their diet better and get weight down. regardless of whether someone is pre-diabetic, not diabetic yet and just overweight, or they have overt diabetes. From a blood sugar standpoint, exercise is more effective at improving blood sugars than diet for the most part, because exercise also churns up some of the glucose that your body uses for energy when you exercise. So if you have a person, two identical people with the same body mass index, one who exercises on a regular basis and eats too much, the other one who doesn't exercise at all but eats less, the one who exercises more on average will tend to have a lower blood sugar because they're using it up for energy throughout their exercise and what they do during the day. From a weight standpoint, diet is much more effective than exercise. And I talked about this briefly before. A small Twix bar is about 100 calories. It takes 10 minutes on a treadmill to burn off the calories that you took in from a Twix bar. So in order to get weight down, taking in fewer calories is going to drop weight much quicker than adding exercise, unless you add a lot of exercise, which is harder to do. Patients come to me and say, I can't be diabetic though because I don't eat a lot of sugars. Well, I brought this up before. What causes diabetes isn't eating sugars, although sugars are calories. What causes diabetes is taking in more calories than someone needs and not burning them off and gaining fat cells over time. Once someone does have diabetes, then it becomes very important to watch the blood sugar someone takes in, because once they're diabetic, that means their pancreas can't produce enough insulin for the glucose that's taken in. And watching out for the glycemic indices of foods is very important. When someone doesn't have diabetes, for example, I don't have diabetes, my diet contains 70 to 80% carbs on average. A high carb diet is not a bad diet to eat if you exercise on a regular basis. It's a great source of energy. That energy gets used with exercise, and it doesn't impact my risk of developing diabetes. As I just stated though, once someone is diabetic, a high carb diet you have to be very careful with, because it's much harder to control the sugars because your pancreas doesn't produce the insulin to stick to the high carb diet. Preventing diabetes doesn't occur from high protein or high fat diets. So there was a big craze for the past 10-20 years, and everybody has to have a low carb diet. Low carb diets for a diabetic is great, but low carb diets for a non-diabetic, if you replace those carbs, especially with high fat foods are typically higher in calories. The higher calorie foods also tend to raise your cholesterol because they're higher in fats, end up gaining more weight than the people on low carb diets. The flip side of this is everybody's brain has both a turn-off mechanism when you eat to sense when your body's full and to suppress your hunger in between meals. Some people's brains are set at different levels where they're not full until they take in a 1,500 calorie meal, or 2 hours after a meal they get hungry again. Carbohydrates tend to get out of the system a little quicker, where protein tends to stay a little bit longer. So higher protein meals for patients that have a higher hunger level often work a little better than higher carbohydrate meals on average in helping to get weight go down. So it depends on the patient as an individual as far as preventing diabetes and what's best from a weight standpoint. But if they do get exercise on a regular basis and are not diabetic, there's nothing wrong with having a predominantly high carbohydrate diet. Remember, high carbohydrates are also high fiber foods. Fibers are a carbohydrate. High fiber foods are beneficial for a lot of reasons outside of the discussion of diabetes. The other thing I always tell patients is if you really enjoy eating ice cream, I'm not sitting here telling you you have to give up your ice cream after dinner. If you eat 2,000 calories in a day and 300 calories come from ice cream, well, the 200 calories that you care about the least, eliminate those 200 calories. If you always clean up a pot and get seconds, if your first plate is too big, if you munch on chips or you have a can of soda in the middle of the day and you're doing it just because it's there, give that up. So you don't have to be miserable for your entire life and give up the things you like the most, which is when you watch TV and you see ads for Seattle Sutton or the calorie-controlled diets. Those work well, and they advertise you can eat the foods that you want, and that is correct to a certain extent. You have to limit what you eat, but you can still eat the foods you like to eat, but you still need to limit your total calories. The turn-off mechanism that I just alluded to, where people either eat larger meals before they're full or get hungry in between meals and snack every few hours, we now have drugs Ozempic and Mounjaro are examples of them, but the entire class of drugs called GLPs, unfortunately the majority are injections, but they work very well. Both help to make people feel full earlier, and in between meals, they're not hungry. So some of the older drugs like Fen-Phen, for example, which was a bad drug from a heart standpoint because it increased the risk of heart attacks, was great because it made people eat less meals, but they also will get hungry an hour or 2 hours after that meal. The newer drugs work very well where your meals are smaller, but you're also not hungry in between the meals. So weight comes down dramatically with these drugs. And starting a drug doesn't mean, once again, that you need to take it for the rest of your life. Once weight comes down and patients have formed good habits, many times those patients come off the drugs and never go back to their previous weights. Some people, their hormones in the brain that control the hunger come back to the same place they were before and the weight starts going up. And then those medications may be good lifelong medications for patients to take. So it just depends on the habits that someone was able to change and if they can stick with those habits off of the medications. This video focused mostly on medication and diet. I will record a separate video that focuses more on the exercise portion of the equation. I hope you have a good afternoon.